Hello, everyone. Thank you so much for holding it. It's another day. My name is Ransom Manuma. I'm a third year medical radiography student at Federal University of Technology, School of Basic Medicine here in Nigeria. And apart from my medical studies, I'm also a proficient medical content writer. I do a lot of writings on medical articles, medical blog content, and I work with pharmaceutical or healthcare companies out there, and also I work with personal clients out there. So today I have an amazing guest speaker. Ahmed talks with Dr. Janet. Hey, doctor, could you introduce yourself?
Hello, everyone. I'm so happy to be here. My name is Dr. Jane S. Thomas, and I'm a medical doctor currently working at the University of Calabar Teaching Hospital, Nigeria. Apart from medicine, I'm also a storyteller. We all are storytellers. So, yeah, that's basically my short intro.
You're welcome. You're welcome.
Thank
So, are you ready for the questions for you to
you.
answer
Yes,
for the audience?
I am ready for the questions.
So, if I'm looking downwards, I'm reading the questions to her for her to, share her own narratives on these questions. So, the first one goes this way. Can you share a memorable patient story, that taught you an important lesson about living healthy and a fulfilling life? So, what are your thoughts on that?
Well, that is a wonderful question. During my practice as a medical doctor, I've met so many patients, and I'm actually thinking of whose story do I share and whose stories do I leave out. Just a lot of beautiful stories of patients who are living know the importance of health and how the importance of living healthy and having a, what's the second question again?
And a fulfilling
Can you
life.
hear?
Yeah.
Living a healthy and a fulfilling life. All right, thank you. Okay, I'll share the story of a beautiful 86-year-old woman who I met when I was in my internal medicine rotation. She had about 4 or 5 children, yeah, and we managed her for difficulty in breathing. She has other issues basically, but then I was in the respiratory unit. So the managing team called us to, come and see her because of the difficulty in breathing issue. So when we came, one remarkable thing about her is how supportive her family is. Like they were so interested in not just the diagnosis or what we're managing the mother for, they were interested in knowing what caused this, how can we prevent a future recurrence, what can we do to make it better, what the investigations that we are ordering, why are we ordering it, what values are normal, what values are abnormal. So I can imagine how much the woman, when she was before she was admitted into the hospital, she has invested into her family in order to have such a close and caring family members who will surround her at such situation. Because we have seen series of patients that when they come to the hospital, we don't find family members. In fact, we as doctors, we have to be the ones to go out there and look for people that will caregivers that will come and take care of the patient. So as a patient, as a human, even before you fall sick, just make sure that you have a network of people that you support, and the support you could be your family members, it could be your church members, it could be your neighbors. Just live a good life as a human, live a balanced life, and live healthy too. Because normally, if you're careful about your healthy living, careful about what you eat, careful about exercise, careful about taking care of yourself, when you fall sick, it's easier to recover, you understand, than if you've been living a life of carelessness. It takes a longer time to recover. Now, let me share another story with you. We had a patient, a diabetic patient, who did not know she was diabetic. Her children did not know she was diabetic. And then, one of the complications of long-term diabetes is they come up with this symptom where, they lose sometimes sensations in the different parts of their body. Sometimes it could be the lower part of the body. So they could have an injury there, and they will not know that they have an injury until it's late. So that was what happened to this woman. And the story is actually a sad one, because they mismanaged the woman at home before bringing her, and because of that, the woman entered. She had developed sepsis, generalized infections of the whole body. She was just going, and that was a really sad one. So assuming the woman was intentional about healthy living, she would have been going for medical checkups from time to time. You understand? And during one of those checkups, they would have definitely told her, Madam, you have a problem with your sugar, and they would have put her on a good blood they would have put her on a good glycemic control, which will make her to take good care of herself. So even if she comes down with any illness, it will be easier to manage. So I think that's what I have to say concerning that question. I don't know if I answered that.
As a medical student, I really concur with what you just said. Majorly what triggered my intention to say this was about having a supporting system and also
Yeah.
going for medical checkups.
Yeah.
You so we Africans, we are really um adamant in things related to medical checkups and other things related to health and stuff.
Yeah.
So this is the reason why I started this YouTube channel to bridge that gap.
Yeah.
One needs to go for medical checkups at least two times in a month or three times or even once in a month, but just have to go for medical checkups.
You
To
don't
check
have to be sick. Yeah, you don't have to be sick before you go to the hospital. Healthy people come to the hospital to prevent being sick. So that's the importance of what we do.
and also having a supporting system. Yeah, I do agree about that. And I believe that the audience grabbed something. Thank you so much for sharing that.
You're welcome.
So, are you ready for the second question?
Yeah, shoot.
And how do you balance the demands of being a medical doctor, right, with your passion for storytelling? Hmm. And how does each aspect complement the other in your life? So tell us how you balance those equations.
Well, that's another good question. I like being a doctor, actually. I like seeing my work impacting lives and seeing them get better. I also like being a storyteller. Like I said in my introduction, we are all storyteller, but the difference is what kind of stories are you telling? I have chosen to use my storytelling skills to talk about my medical experiences, to teach people about health in simple terms. So that is actually the aspects that my storytelling comes into play. Now, why am I telling stories? I tell stories because it helps me to connect to people. It's very important for people to know you, to like you, and to trust you as a medical doctor. And one of the ways you do that is by telling stories. Now, my storytelling doesn't just end online. Sometimes when I talk with my patients, I use storytelling to explain to them what they are going through, how it can get better, and other people that have gone through that, and the end result or the outcome of that. So basically, storytelling helps my work in the hospital as a doctor. I don't talk to my patients using medical terms, or even if I do, I try to explain it in a way they will understand. And when you talk to them using stories, it helps them to relate better to you. Also, online, when if I come online and start writing medical terms and medical jargons, or I want to talk to you about how to live a stress-free life or what hormones or I release, I'll start talking about, okay, you talk about cortisol, I'll go into the pathophysiology of cortisol. I'll talk about adrenaline, I go into the pathophysiology of adrenaline. Nobody will relate. It's only my fellow colleagues that will understand what I'm talking. But when I tell it in the form of storytelling, or I break it down to the barest terms that even a 12-year-old will understand what I'm saying, I tell you, okay, these ones are called happy hormones, these ones are called hormones that gives you stress. You understand? You understand what I'm saying. So it kind of build a connection with the people that I'm talking with. All right. So, how do I balance my work as a professional? That's part of the question, right?
Absolutely. Yeah.
Yes, and as a storyteller, well, the difference lies in strategic planning. You have to know which one is your priority. My priority right now is that I'm a doctor, and then secondarily, I'm a storyteller. So anything that would disrupt my work, I know I have to avoid that. So I need to plan myself very, very well and prioritize myself. So I the whatever is, I know that these two things takes my time, so whatever is going to be a time or a distractor or something, I try to cut it off. Whatever it is, maybe the time I would have used in doing other non-productive things, I just know that I have to eliminate it because I need to do my work, and medical work is quite straining sometimes you come back late, you don't even have that time during the day, you're seeing patients. And then when I come back, I know that, okay, I have to update my community on LinkedIn or Facebook. So I need to write, I need to schedule my post and all that. So planning is very strategic in combining anything you are doing. Some people are not storytellers, some people are business people, and they are doctors too. So you see, strategic planning helps you in whatever you are doing, whether you're a professional, combining it with another thing, another. If you don't plan, you won't do much. And then you have to know how to delegate some activities. You cannot do everything. You cannot. You need to know how to delegate whatever it is that is just a time waste that is not productive, but you need to do it. Get someone else to do it. Get someone else to do it. If it's employing someone to help you with content creation, if it is employing someone to even help you with your daily chores so that you free up time for things that matter to you, you need to do
Hmm.
it. Yeah.
That was an amazing narrative you shared right there, because it also relates to my work, you know, as a medical student and also a medical content writer. These works are really straining, right?
Are you there? Can you hear me? Are you there? Okay. Are you there?
Yeah, sure. I think
Okay.
it was a network issue.
Can you give me a minute, please? Just a minute.
Yeah. So I was talking about balancing being a medical student and also being a medical content writer. For me, it's really a very draining kind of work, because being a medical student is a full time job, and
Yeah.
having a second party or having a third party is also a distraction for you.
Yeah.
So, but we in Africa, we have to, in Africa, we can do a couple of thousands of jobs in 1 second. So, with that knowledge, I tried to balance those equations at sourcing, finding time that suits the two and giving the priorities to each of them as needed.
Yeah.
So, thank you so much for sharing that, Dr. Janet.
You're welcome.
So, the third question goes this way. You ready?
Yeah. Yeah.
What advice do you have for individuals striving to maintain a healthy lifestyle, while juggling with their professional responsibilities and personal pursuits? So, what are your thoughts on that?
Well, I would say part of the last question you asked, the answers are just the same way. To live, you know that you have to prioritize healthy living. If you're sick, you can't do much, right? So you need to prioritize your health. You need to know how to manage stress. That's another important factor as a professional. You need to know how to manage stress. And this include knowing when you should stop, knowing when you need your rest, knowing how to rest. There's a difference between knowing when to rest and then knowing how to rest. When you're resting, are you really resting? When you're resting, it shouldn't be the time when, for example, I don't know what you do, or I'm just using an example of maybe someone who is a professional content creator, or someone just who works with a screen all day. When you are resting, it's not a time to look at your stream. Facebook should not be a means of resting for you if you're someone that works with your screen all day, because you need to give your eyes break. You understand? So know when to rest and know the appropriate rest that will help refresh you. Another thing is also knowing how to incorporate exercise to your routine, because I will always say it: if you don't exercise, you are not really living an optimal healthy lifestyle. And when I say exercising, I don't mean climbing Mount Kilimanjaro, I don't mean running a marathon, I mean doing the basics that you can. Okay, the American Heart Association actually suggests that 30 minutes a day of exercise for 5 days can do the job, and this includes brisk walking, taking the staircase instead of using the elevator or driving all the time. You can even park a distance from your workplace and just trek. This includes dancing. Dancing is a form of exercise. So know how to exercise so that you can get your body function. You can get your body functioning well. You can get your circulation, running well. Know how to
The question goes this way. Another one. What advice do you have for individuals, striving to maintain a healthy lifestyle while juggling with their professional responsibilities and personal pursuits? So, what are your thoughts on that?
All right. Like I said before, you need to prioritize your professional pursuits and then prioritize other things that you're doing, which is more important to you. If your professional pursuit is more important to you, then every other thing should be, work it around what the most important thing in your life is. And like I said before, strategic planning is very important. You need to learn how to strategize. You need to learn how to network with people that are already doing what you're doing. Learn how they started, how they are managing, and these challenges they have. You don't need to go through those challenges again to learn. You can just learn from people that have been there before. This is where mentorship comes in. If you know someone who is already doing what you're doing, just reach out to the person. Even if it needs, paying for their time, you can just do that. Go to YouTube. If you have any challenges, just type it in. You see a lot of videos explaining, if they are like this one that we are doing right now, explaining how you can actually work around that. So I basically believe that it is. And another thing is, if you're a professional who is also pursuing other things and also want to live a healthy lifestyle, you need to learn how to manage stress, because sometimes it can lead to burnout. Doing a lot of things at the same time can lead to stress and burnout. So learn how to manage stress. And I'll just give you a few things. I write about it mostly on my LinkedIn page. Rest, know how to rest, and know the rest that is appropriate for you. Is a different thing to know that you need to rest and the appropriate rest for you. For example, if you're a professional that works with a laptop all day, you know that spending so much screen time on your laptop is not healthy for you. So how do you do that? You need to take breaks every 20 or 30 minutes. Look just away from the screen and look at a distance. Get up, walk around, drink water, come back. And then when it's time to rest, close your laptop, close your phone. Don't go on Facebook, don't Netflix. You can read a book or do any other thing that doesn't involve you looking at a screen. You are saving your eyesight. Secondly, you need to learn how to, exercise. When I say exercise, I don't mean climbing Mount Kilimanjaro or running a marathon. The American Heart Association actually recommends 30 minutes of exercise per day for 5 days. That can do the job. And the 30 minutes of exercise can just be something as simple as taking a brisk walk, climbing the staircases of using the elevator, parking your car a distance from where you work, and just trekking down. That can be, even if you don't have time for 30 minutes of exercise, you can break it down. 10 minutes 3 times during the day, 10 minutes during the 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes in the evening. You can dance, work for 10 minutes, then do it repeatedly for 3 times throughout the day, and you've achieved the same goal. So I think basically that's the answer to that question.
Perfect. Perfect. And I believe that the audience would greatly appreciate that. And that was an amazing nugget. Thank you.
Thank you. Yeah.
So we have four more questions to go. You ready?
Yeah, yeah.
So the fourth question goes this way. So, in your experience, right, what are some misconceptions people have about achieving a balanced and fulfilling life, and how do you address them?
Well, is possible to live a balanced lifestyle. Is possible to achieve it. Okay. Now, like I said before, you just have to know what is important to you and how to plan around it. Planning plays a huge role if you're doing so many things at the same time. You have to plan, you have to learn how to delegate, you have to learn how to rest. And when I say rest, I don't mean like just accidental rest. I mean schedule your rest in your activity. You know how I've scheduled this interview? I'm talking with Ransom on Saturday morning by 10 a.m. is in my schedule. I know this is what I have to do. I schedule immediately after this interview. I have another thing coming up. Just like I've scheduled my day, I also scheduled this is the time that I'm supposed to rest. No matter what happens, nobody's pulling me out of my rest at this moment. So that is just it. You have to be intentional. You have to delegate. You have to, do things personally for yourself. It's very easy to help others and forget yourself, but you are the most important person in this equation. If you're not healthy, if you're not okay physically, mentally, spiritually, financially, everything, if you're not okay, you cannot help another person. So prioritize yourself rest, plan yourself, delegate activities that will take you down. So that's what I have to say. I have to live a balanced lifestyle. Yeah.
I'm speechless. I don't know what to say. If you've covered a lot, like, wow, I love that fact you talked about scheduling your rest.
Yes.
Wow. Hmm. 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 I think that should be on my to-do list.
Yeah. Okay, you should. You should.
And I believe that the audience should have it on the to-do list too. Have everything you do in this life. Let it be something you picked out from this video, right? Try to
Yeah.
schedule everything you want to do, so you won't have a a doubled attention, right? So just schedule. Hey, this is what I'm going to do at this time, this time, this time. So you won't have something, trying to like make you distracted. So thank you so much for sharing that, Dr. Janet.
Yeah, you're welcome.
Well, tell us how is the in your state here in state like your state in Nigeria? How is the healthcare system right now?
Well, that is a good question. And before I answer that, I just want to encourage the audience. I know you are getting value from this. So just if you have any question about anything I've said or anything Ransom have said, just drop it in his comment section. He will come back and respond to it. And don't forget to like this video and subscribe and share to your friends so that they can come and enjoy what you're doing today. Right. Now, the healthcare system in my state. I've been living here for the past 10 months. I'm living in Cross River State. I'm in Calabar, working in the University of Calabar Teaching Hospital. I cannot really say much about the healthcare system here because I haven't been here for that long to talk authoritatively about how it is. But basically, what I have to say for the past months that I've been here is that people make use of their tertiary hospitals here a lot. The teaching hospital. There is no federal medical center here. What we have here is General Hospital, Navy Hospital, teaching hospital, and then other private centers. They make use of their tertiary institution a lot, and the referral system is good, especially from the private hospitals and from General and the Navy hospitals. The manpower in teaching hospital is great, awesome. Here you have professors, qualified consultants, registrars, and then house officers, nurses. Very good referral system here. But I would say that we still have this problem of people when they are sick, instead of seeking medical attention, they prefer to go to their churches. They prefer to go to these traditional healing centers that are not really licensed by governments to take care of things like that. We also have the primary healthcare system here that people, they use that one a lot. All I'm just saying is that when a patient gets into the appropriate medical system, there is a good referral. But when they go outside this laid down government approved medical structures, the management becomes it becomes nasty. Now, a few days ago, this week, we had a patient who is a woman. She's pregnant, and the pregnant is actually term, and she was in labor. Now, this woman is in labor. Instead of coming to the hospital or even going to the nearest general hospital close to them, they decided to take her to a church. And when she got to the church, the spiritual leader there declared that they are going to start praying and fasting for the woman. And that was their healing strategy. And then this woman stayed there and labored until she fell unconscious and started convulsing before they brought her to the hospital, and the outcome was not good. Now, what was the problem? This woman cannot deliver by herself. She has obstructed labor. This woman has is eclamptic. You understand? If you understand what I mean. So it was really an all-round nasty situation that they could not have managed. This is a case where you see this kind of case, you refer to a higher center that can manage this woman. So that is just it. I actually am working on creating more awareness. It's not just about that aspect maybe of pregnant women, even in children. I did a research about 8 months ago on the home management and attitude of mothers in Calabar when their children have febrile seizures, that is convulsion, that is caused as a result of increase in temperature caused by fever. And most of them were enlightened about what febrile seizure is, but you still discover that some of them have nasty practices like burning their children's feet when they are convulsing, giving them herbal concussions, right, putting it in their eye. That can blind the child. So there's still a lot of superstitious or unhealthy practices going on, especially in the interior or rural parts of the state. So, and Cross River State is a big state. Like, it's bigger than my state. I'm from Abia State, and it's big. So we don't even have enough hospitals for all the patients here. So I think there's a place of spreading, going beyond the structures, the medical structures, the hospitals and all that. Go on radio, go on television. These local folks in their villages, they listen to the radio. Go on radio and spread the medical practices that are appropriate so that we can save more lives. Thank you.
Wow, wow, wow. This talks about giving priorities to what is needed. And, I want to talk about something. Priorities on something that is very important is really, really, really important, like going to church and also going to hospital. That
Yeah,
story you shared about, that incident that's just happened wasn't meant to for the church.
it
That's
wasn't
why
meant.
it wasn't at all. It wasn't. You just needed to go to the hospital,
Yeah,
a licensed hospital, not just any hospital, because that licensing is very important, right? Because if
yeah,
you
yeah.
like, I did a research about how a lady, an Italian American, that was dishing out medical operations at Uganda in Africa here, but she wasn't a doctor. She wasn't licensed. Wasn't everything. Nothing related to medical. She didn't do anything related to medical, but she was giving out drugs and everything. And she was arrested. I did that research last year. She was arrested. And that's what I try to say to people, that in everything you do, try to know it. Even my studies in radiography, there are some restraints, right? There are some things I face that the professors are not really doing what they're supposed to do, coming for classes and stuff like that. But I don't let that to get to me. Why? Because I know that life are in my hands, right? Because I'm going to save a life tomorrow. And if I don't know what I'm doing, I could kill a life. So that's why in everything I do, I try to know it and have the idea, not just the diploma or the certificate or whatever. I just, once I certificate is behind. I was speaking with my classmate yesterday in school, and we were talking about the misconceptions about medical professionals, especially nurses, how to treat the patients really bad. They're so rude to them, especially federal hospitals, because I've been to several hospitals here in Imo State during my clinicals, radiography. I've gone to several hospitals, and especially the federal, the way they treat patients, because they have not paid for the cards or they haven't done this or done that. Because my experience, my friend told me, my classmate was like, when he went for the hospital with his mom, the patient in front of him was suffering at the last stage of diabetes. I think it's the fifth stage. That started eating up the patient's legs, eating up the patient's leg. And the receptionist at that hospital was never cared about what happened because the patient hasn't paid for the cat or hasn't bought the cat for to go see the doctor or something like that. But what we came to that was my first post I did this morning a few hours ago. That even though the patient hasn't done the necessary deeds like paying for the cat to see the doctor, he or she deserves some attention. During my studies in radiography, my second year, I thought that my professor Dr. Thomas Dejo, he's now a professor at the University of um was it University of Unizik, yeah, Unizik, yeah. University of Nnamdi Azikiwe University. I was a visiting lecturer in our school. And he also teaches at David Umar University at Funai. And he taught us about psychology and radiography. That talks about in the measure of everything we're doing in the hospital settings, patient is the key. Patient is the king in the hospital setting. And everything that is happening in the hospital setting is because of the patient.
Yeah.
The patient is the king in everything you do. So in everything you do, try to give attention to the patient because it's not because he has not paid for the cats and you just neglected the patient and he was eating the patient's leg, eating in front of my classmates, in front of my classmates at the hospital, and they never cared about it, and that's really terrible. And I did a publications about using do you know the Celestry test in medical practice?
The what?
CELERY test. Do you know about the test in medical?
All right. I think I've heard something about that. Just talk about it more, please.
Yeah, I did a research about, like I said, about the mismanagement of patients, especially in federal hospitals in Nigeria. And that inspiration came to me because of my what I discussed with my classmate yesterday,
All
and
right.
also MedPage. There's a company, the medical company in the UK that that writes medical publications. MedPage. They talked about that test, and I got some inspiration off it, and I made up publications. It's all about using the necessary methods. This test is majorly for the patient, right? In everything you do, in a nutshell, because of time, I'll just have to summarize everything. In a nutshell, all you have to do is your focus is on the patient, right? So that is
Mhm.
what the test is all about. It's just related to the patient. In everything you do, just face the patient and don't allow distractions from right and left or whatever. Just focus on that patient. So that's a little bit about that test. You can read because I made up publications on my LinkedIn page. You can go over there and read it. I made it
All
on Medium.
all
Yeah,
right. I'll check it out. I'll check it out. That's a good one.
sure. But have you experienced such um daily attitude from medical professionals towards patients, being so rude to them? Have you experienced that before in your
Yeah.
practice?
Yes, yes, of course. But one thing you should know that in every establishment, be it a government or a private establishment, there are actually people that are good, empathetic people, and then there are actually people that are not so good with relating with patients or relating with anybody in generally. There are people that when they are stressed, they don't give you the best attitude. And you know, in government hospitals, mostly they are understaffed. There are just a few people seeing a lot of patients. Even as doctors, sometimes you go to the clinic, you are the only person. Like last week, I was the only house officer in triage. The triage is like an accident and emergency in O&G department. So, and then my senior comes in and says, why are you the only doctor here? People should be two here because there were just a lot of things to do. You know, patients coming in, and since it's an emergency, they don't come in normal. They come in pains. Some coming bleeding. Some coming about to die. Some coming about their babies doing this and all that. So you are actually talking to this person, trying to get a short history, so you know the first line of management. This other person is coming, doctor, doctor, come and attend to my patient. So, and you're like, okay, okay, just hold on, one after the other. Let me just attend to this one. I'll come over to this one. So in such situation, it's easier to just flare up and get rude and maybe shout at the patient and say, "Can't you see I'm attending to another one?" There was one of these patients that came in. By the time she came, she was actually in pain. She was crying, and I was already talking to another patient. And then the ward was full. There was no free bed for her to lie down. So I was like, what am I going to do? So the brother was like, why can't you send one of these other patients up and let my sister have the bed? I'm like, all these patients, everybody is important. There's nobody I can send. I am not Nigerian government that does not provide enough facilities and beds for all the patients. So I just had to calmly talk to them, because we are being trained as new generation medical doctors to be empathetic, to have empathy for patients. So no matter how stressed you are, no matter if the A&E ward is filled with patients who are crying, yelling, pulling at you, you just have to be at your best professional behavior. But then at some point you see someone, maybe it's a doctor or a nurse that have been on duty from morning till night, all the patients yelling, everybody's just calling you at the same time, and it's just you. Sometimes you just get tired and you're like, you know what? You know what? Look, I'm done with all of you. So, but yeah, I think it's important to know when you are approaching that point that you are no longer at your professional behavior. It's time, even if you have to take a short break, eat. And hypoglycemia also has a point to play in how you relate with people. Eat, take a drink, just do a few minutes of exercise, and then come and you are refreshed. Then if you're someone, or if you know someone, or if you're a patient, and maybe you have recurrent visits to the hospital, and you discover this medical staff that is always rude, is not something that, like I said, that occurs once in a while, maybe when she's stressed or because of the number of patients the person has to deal with. You just discover, whether you come by 6 a.m., 7 or 8 a.m., this patient is constantly rude. There is something called human relation service in the hospital or something. In my center, what do we call it? Servicon. You go and report that staff there. You should not be afraid. Walk in my hospital, they have a stand, they have a department or somewhere there. So you just go there and say, Doctor so and so is not treating me right, or no, so and so has been so rude. Those people, they are very active. Like, as you are reporting, they follow you down to see what's happening. They come to investigate what is happening. You understand? Sometimes you don't even need to go there. There's a phone number to call there. You just call them and say, hey, I've been in triage, I've been waiting to see a doctor, or the receptionist is not nice to me. As long as you've done what you're supposed to do, you understand, you can feel free to report the person. They'll come and investigate. And if the person is wrong, just expect that they will take up the matter from there. And if patients can be able to do this, and then the staff learn that, oh, if I misbehave, I'm likely going to be reported. And once I'm reported, the management is going to take a strict action on me. Everybody is going to sit up. I'm telling you the truth. So that is how it is. For us as medical doctors, we are always careful about how we deal or relate with patients. We try to be, relate to them with empathy. We know that these patients have access to our chiefs, our bosses. Some of them in the hospital, they tell you that the patient is not your patient. The patient is the consultant's patient. You understand? So I know my rank. As a house officer, I have a boss who is the junior registrar. The junior registrar has a boss who is the senior registrar. The senior registrar has a boss who is the consultant. And the consultant has a boss who is the prof. So the prof is like the head of the unit, and he is the owner of the patient. Like, the patient belongs to him. So if I'm talking to a patient and I am rude, they all have access to the prof and to the consultant. They can just straight up report me, and then I will be given the appropriate disciplinary action. You understand? So it makes me to, be cautious of what I do, knowing that everything I do has consequences. If I'm nice, they can recommend me for greater opportunities. They can just put in a word of kind word with my boss, and that will be a good one. And if I misbehave, they can report me, and I can be given a query, and that is not a good thing to have. So yeah.
Mm, mm, mm. Wow, thank you so much for sharing that with us. So have you had any experience working with a radiographer or radiologist in the hospital?
Yeah, of course we do. We do as doctors. We do work with them a lot. We send them. We're always sending patients for different kind of radiological investigations. Depending on the department where you are. I've gone around surgery. We can't do much without radiology and surgery because we don't want to work blindly. Sometimes we have to even invite them right there in the theater as the surgery is going on. They are doing their things, and we are looking at what we are doing in real time. And
Yeah.
then in internal medicine, we also send them for radiology. Sometimes they come to the ward, carry their equipment for those patients that are not able to move. Some patients are so critical, they're on life support, they can't move. So the radiologists come. We work with them as they are doing their things. We are there looking. They give us their own interpretations. The radiographers are also radiologists are also doctors. So we don't treat them like they are just there just to do the investigations. No, before we send any patient there, we write all the details, we write the bio data, we write the diagnosis, what we are managing the patients for, and then what we want to request. Sometimes we tell them that when they want to start the investigation, they should call us so that we can come there and just stay there and we say, okay, obstetric scan, this is exactly what we are looking for in this scan. They are the experts. They know how to position the patient. They know exactly what to do so that we can see exactly what we are looking for. So it's a collaborative effort between us. We cannot do without each other. It's just not possible.
Yeah, man. And, I love the fact you talked about they're into surgery. A few years ago, when radiography wasn't rampant in the healthcare industry, you guys do surgery without knowing where the actual point is. You guys keep on tearing the body, searching for maybe a bullet. A patient was shot or something. You're looking for the bullet on or whatever. You start piecing, tearing up the parts. You don't even know where the actual location is. But due to the intervention of radiologists and radiographers out there, they just have to just do a scan on where exactly the bullet is. You just have to just call to that place, and that's why they are the forefronters of healthcare. Yeah,
Very important, very important. We've had like when I was in orthopedic posting, where you are doing so many surgeries. Maybe you're doing replacing the kneecap, you're replacing the hip, you're doing all that. You don't even need to finish and call it. They are right there as you are replacing. They are doing everything, showing you, okay, has it entered? Okay, it's not yet in the right position. Let's adjust. So you don't do multiple surgeries on one patient. As you are doing, you see what you're doing. If it's in the right proportion, okay, is the head, does it fit the cap? Oh, it doesn't fit. Okay, let's adjust as you are doing, they are just, showing you what you are doing in real time. So once the surgery is done, everybody is good to go. The patient is fine. You are fine.
yeah, absolutely. Thank you so much, Dr. Janet, for sharing that with us. So we have three more questions to go. Mm, 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 mm. So the fifth question goes this way. You ready?
Yeah, yeah.
Okay, so can you highlight some key habits, right, or practices that contribute to both physical mm, 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 and mental well-being, right, based on your observation as a medical doctor and a storyteller? So, what's your thoughts on that?
Okay, this question, is it directed to doctors or professionals or what?
Yeah, your own narrative as being a medical doctor and a storyteller at the same time.
Okay, so some of the habits that contributes to health and physical well-being, right? That's a question.
Yeah.
Hmm. All right. So I'm going to repeat what I've said before about stress management is very important as a doctor. Like I told you, we see a lot of patients and sometimes it can be very stressful. So learn how to manage stress. Learn when you're stressed. Do you know that some people don't really know when they are stressed? Like their body is giving them signs, but they are still like claiming to be Superman and Superwoman. That's not right. You will break down. Like when you break down, the breakdown will be so terrible that it's going to take a longer time to recover. So know when you're nearing your limits and just excuse yourself from that environment. Take enough rest, appropriate rest, and do whatever it is. If you're a spiritual person, and then do your thing, meditation, go doctor friends, are actually some of the best footballers I know too. I'm not really into that, but I know some of them. Every Saturday, every Sunday morning, they're always out there, pushing each other on the field. So it's a good way to relieve stress that has piled up during the week. Then, as a doctor too, I'm not just whether you're a doctor or any professional, don't just study things that are related to your profession. Study broad, know what is going on in other aspect of life. If you must be a good storyteller, then you have to have a broader knowledge of what to talk about, listen to YouTube talks and all that. Another thing is that you know what's happening around the world. Sometimes you can just go on Twitter and do a little banter and feel good. Engage in recreational activities, like you can go on picnic with your colleagues. Last week, my colleagues, we went to Tinapa and we had a good time. I always remember that memory. It's a good one. Then go on vacation, travel. You don't need to plan all these things for so long. Just travel, or you can even leave your home, go to a new environment, nice hotel, a nice vacation place, and just hang out. And then also networking is good because it exposes you to other people that you've not known. Go to conferences, go to events, and when you go there, don't sit down at a place, go and talk to other people. So January, I went for a pediatric association conference. As a house officer, I actually didn't have much business with going there, but because I'm someone that likes, it's an international conference, why not? And I have a paper that is a research paper that is focused on the pediatric population. So why not go and present? I applied and they asked me to come and present. It was a poster presentation anyway. But the most important thing was that I did a lot of networking. During that event, I met different head of organizations. I met people from World Health Organizations. I met people from UNICEF. I met people from other UNESCO, other organizations. I met medical doctors, professors, those that I wouldn't have met or that would never come to my center for anything at all. I met them. Some of the medical doctors I follow online too that talks about all these health talks just in the same niche with me. I met some of them. So these are some of the practices you can do actually to help you live a balanced life as a doctor. Mhm.
Wow. 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 That was so deep, Dr. Janet. So deep.
Thank you.
Thank you so much for sharing that. So we have two more questions to go. I know you're very busy,
Let's
so I didn't have.
let's keep it quick, yes, because I'm just looking at the time. I have another thing scheduled after now, so I have to go.
Mm.
Yeah.
So how can storytelling, in a nutshell, right? How can storytelling be used as a tool to inspire others to prioritize their health and pursue their goals in a nutshell because of time?
Yeah, in a nutshell, I'm just going to answer that question using an example. Do you know of Dr. Chinonso Egemba, aka Aproko Doctor?
Yeah. Oh my goodness, I know.
Yes, good. Now, do you think that what he's doing is inspiring people?
100%. You know the reason? Because of the kind of content it does. And he uses storytelling, yeah, so I do agree.
Absolutely. So that answers your question. Using storytelling will make you, share your knowledge in such a way that it inspires a lot of people. Like Apoko Doctor wants to teach you that shawarma contains eating Jones contain about 1,000 calories. He will now come and sit down and start reading scripts and telling you the pathophysiology of how everything goes. No, he will tell it in such a way that everybody relates using story, making it fun. So that's just how you can storytelling helps you. I think that
Yeah,
answers the question.
yeah. It does. It does answer that question. Thank you so much for that. Nice
Yeah.
illustration out there. So the last question goes this way. What role do meaningful relationships play in promoting overall wellness? And how can individuals cultivate and nurture these relationships effectively amidst their busy lives? So what are your thoughts on that?
Hello, can you hear me?
Yeah. So what are your thoughts on
Okay.
that, on this question?
I didn't get the question. Please come again.
Okay, what role do meaningful relationships play in promoting overall wellness? And how can individuals cultivate and nurture these relationships effectively amidst their busy lives?
All right. Another one way we can do that, like I said, is by networking. Go out of your way to meet new people, people that are whose works are relevant to what you do, and even people outside your field. Like a medical doctor, I network with a lot of people. Some people are the they don't like maybe will I say photographers, people that make movies and all that. It's not related to what I do, but by networking with them, it exposes me to okay, this is what they do, and from there, if I can even get content on what to create. Like people that do this kind of work, these are the kind of practices they should do in order to enhance their healthy living. And apart from networking, from time to time, you should actually check up on people you know, your support system. Simple, send them a text, call them. I just wanted to check up on you. That's very good conversation starter. I've not seen you for a while and I want to know how you're doing. I just checking on you. From there, if you have any issues, we can just trash it out. And if I also have, I can just tell it at the same time. Just check up on your friends, network and make new friends. Always, try to be in the know of what's going on around them. So by so doing, you just build a network of people that care about you and that you care about.
Thank you so much for sharing, Dr. Jenna. You've been an amazing guest speaker, and we've come to the end of the session. And so, thank you all for watching. If you love this content, do well to subscribe, like, and comment, and share to your network as well. Thank you so much.
Thank you so much, Ransom. Thank you, everyone. I'm so glad that you had me here. If you want to read more of my stories and more of what I do, feel free to connect with me. Send me a connection request on LinkedIn. I'll always accept. Send me a DM. Just, let's connect. Let's be in each other's community. Let's talk. All right?
Absolutely. Absolutely. Thank
Yeah.
you so much. Welcome.